The term twindemic, which was tossed around in the media late last year, refers to the dual threat of a severe flu outbreak coinciding with the current pandemic in the months of autumn and winter. Well, it's that time of the year again here in this part of the world. So in today's panel discussion, I have health experts weighing in on the possibility of a twindemic this time around. Now, I have Professor David Kwak from Sooncheng University. It's good to see you again, Professor Kwak.
Good afternoon.
I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Welcome back, Dr. Kim.
Good afternoon.
Professor Kwak, in the absence of the long weekend factor, Korea's daily tally today surpassed 2,400 cases. Let's begin with a few words on this latest surge.
Right, so I want to rather be neutral on the matter and only look at the numbers. If we closely followed up on the numbers, we may feel that the trend is rather decreasing slightly from the past week or so, even considering the fact that we had a long weekend over the last weekend, and also we're heading to another one towards this weekend and still. I think what's differing from the past is that the variant that became dominant, the Delta variant, its characteristic is quite different from the past strains in that it spreads much faster to a lot more people, but the symptoms, the dormant period has become much shorter as well. So I think we're beginning to see people that come up with COVID-19 cases that are much sooner than expected before. So in the past, if we were to expect, let's say, a week or two from the contact with an infected person with the original strain, I think we could expect possibly 3, maybe 4 days of symptoms or confirmation of the case with the Delta variant. So the numbers that we're seeing deducing from such characteristics, I think is sort of drawing a plateau rather than drastically increasing or reducing from the numbers that we've seen before. So I think we're going to continue to see not such a without such a difference from the numbers before, but we're going to continue to see the numbers that we're currently seeing most likely, but also realistically speaking, if we were to see, let's say, more complacency from the people due to the long weekend, or let's say family gatherings or social gatherings for that matter, obviously the number is going to increase even further. Let's hope that that won't happen. But as far as the numbers are concerned, because we've been through a long weekend already and we're currently seeing rather a stabilization of the number, I think that's what we are also going to continue to see in the future as well.
Right, and the concern is we are looking ahead to a long weekend later this week as well.
That's correct. So that's further why we need to be extra careful not to be gathering physically with other people yet.
Right. And now, Dr. Kim, what are your thoughts on the likelihood of a twindemic this season?
Well, the twindemic is not really just a new concern at this year. The twindemic was also just a concern just last year, almost around this time.
I do remember that. We talked about it last year as well.
I think so, yeah. And then the last year situation and then this year, this situation is now just quite different because now the vaccine is available. The last year, we did not have any very effective control measures except for just a public quarantine procedure. So the people are tend to be more cautious. So then they actually stick to more rigorously some public personal hygiene, for example, like wearing mask and then keeping physical distances and also washing hands. And that was actually very effective. I mean, this is not the completely new one. I mean, not for just the flu, but for some other other infectious disease. This kind of very simple measures are very effective, preventing the transmission of this infectious disease. But now, now the vaccine is available for certain countries, and then the vaccination rate is pretty high. So there's many actually countries as considering returning to some sort of normal life. So then the people are generally tend to be more relaxed and then less careful about this some personal hygiene. So then the chances are now the twindemic is more possible unless we keep more cautious action like we did last year.
Right. And keeping in mind what Dr. Kim has just said, Professor Kwak, last year we reportedly did mark very record low flu activity, and some pundits are saying because of that reality we might actually see a frightening outbreak this year. Could you explain that for us?
Right, so it's a claim made by numerous doctors, mostly in the UK. And they're theorizing because we lacked exposure to influenza virus the last year, not as much as the ones that we did it before, we're going to have less of the immune system ready for influenza virus this year. And there's also a theory that because every year we have different strains of influenza virus attacking us. So every year, at least about 6 months ahead, a group of people gather to find out or anticipate what exact strains of influenza virus will attack this year. That's how it has always been every year in the past. Now, having had such low numbers of influenza cases last year, it's harder to deduce what kinds of strain might attack this year. So that theoretically means that for the vaccines that are available currently is deduced from very low numbers of cases from the last year, and it just may not work. Now, I must iterate that these are all only in theories. We don't exactly know what strains will hit us every year, and some of the years, even in the past, the vaccines just hit the virus completely off, or some of the years actually it hit right on the spot. So we never know what's going to happen this year, but usually, scientifically speaking, even with the deducing from the lack of the numbers, they're still able to come up with protection from the virus in a sense that it'll still give us immunity to fight against this specific strains of the virus. So I think we're still going to be protected, number one. But also number two, the theory that claims our immune system might be weaker than before due to the lack of exposure, I think it's not so heavily grounded to the fact that we still had exposure to influenza virus. We are still going to be, in many other countries around the globe, many of us are still going to be wearing our mask on. We're still going to be socially distancing from each other, which decreases the chance for even the influenza virus to transmit to others. So I'm still having my fingers crossed that even this year we'll continue to see low numbers of influenza cases as well.
Right, hopefully that will be the case. And Dr. Kim, just for the sake of a better understanding of the dangers posed by being dually infected with the flu virus and COVID-19, what more can you tell us?
Well, this sort of just a twindemic, and this is actually just co-infection of just two viruses. The instance of this co-infection was actually rare last year because of the reason that I just talked about. So then we do not have much data to just talk about that. But then based on some data, maybe just the outcomes from this sort of just co-infection might be just worse than we actually just anticipated. And then this co-infection is, well, sometimes some viruses actually show us sort of just a super infection exclusion. But this is for once the virus is infected, then the other virus cannot infect the same cell. So this is sort of just called the super infection exclusion. But this is not such case. So the one of the recent cases is one of the COVID-19 patient was actually infected with another just a respiratory virus. In this case, not flu virus, but the respiratory syncytial virus. That's totally a different kind of the respiratory virus. So the co-infection itself is very just possible, and it's not just complete new one. But in the case of this co-infection, there's some we have never, just a substantial. The instance of this co-infection. So we do not know what we have to do in this case of the co-infection. For in terms of like a treatment, whether any potential and drug interaction, we do not know for sure. And then, for example, like for COVID-19 patient, for severe COVID-19 patient who needs some oxygen, just a supply, usually we actually just treat with some steroid drugs. But steroid drug is not really, almost is not really good for the flu patient. So in this case of co-infection case, we actually do not have any experience. So it's kind of just complicating issues. But anyway, we have to somehow just deal with it. Yeah.
Right. And staying with that, Professor Kwak, what more can you tell us about the potential risks posed by a twindemic on the local front?
Well, so the most concerning fact would be the fact that if the twindemic was to happen, the medical sector would have to take care of both the patients or the patients who have both the diseases. Obviously, the higher toll it'll take on the medical sector means that the medical sector will now be able to less attend to other disease entities, but also in the same time, vice versa between the flu and the COVID-19. That was also the worry the last year we had, because when we were expecting a twindemic, we had such low capacity to handle both the cases at the same time. Also at the same time, we weren't so quite ready with the ICU beds and isolation booths and whatnot at the time. I think we're slightly better prepared right now, but let's still not forget that even with the readiness that we have, we should still stay most conservative in our attention towards these virus-infected sources and be ready for any sorts of cases, really.
Right. And talking about being ready, Professor Kwak, is there a way to better distinguish between flu symptoms from those of COVID-19?
Well, so that's really a tough question because mostly both the flu and COVID-19 share pretty much the same symptoms. They're both respiratory illnesses, so they show some respiratory symptoms such as coughing or systemic symptoms that can happen from it, such as muscle pain, joint pain, fever, obviously, and high fever for that matter, but also many other coexisting symptoms such as abdominal distension and whatnot, which is not so common as the other ones. But the biggest factor that I want to mention here is that their time of transmission is vastly different. At least for the original strains of flu versus the original strains of COVID-19, COVID-19 had a much longer period of dormancy as opposed to flu, having it at around 3 to 4 days of dormancy before transmission. But what's worrying is that the COVID-19 is also sort of catching up with its period of dormancy. So it's becoming more like flu, except it's still going to cause possibly higher severity rates as well as higher mortality rates. So once and for all, if somebody was to show any of the symptoms that can be from flu or COVID-19, one should go straight to the hospital and be checked of any possibilities and be treated right away.
Right. And Dr. Kim, this is something that Dr. Kwak touched upon earlier on, but given the lack of data on the most potentially transmissible influenza viruses this season, some are casting doubt on the potential protection that will be offered by the vaccines, the flu vaccines. What are your thoughts on these concerns?
Yes, actually, Dr. Kwak just said just a little bit about this. And then normally we expect some protection efficacy of between the 40 to 60% when we actually predict just accurately for the next circulating just influenza virus. But if we fail, it goes down to like a 10% to the 40% of protection efficacy. But then, as this kind of a prediction is based on some circulating just influenza virus strains. From our point of view, the virus is circulating in the southern hemisphere. So it's based on the data like 6 to 9 months before just the vaccination in the northern hemisphere. So maybe the vaccine that we are going to use maybe sort of just outdated, so that the vaccine may not be quite just effective as we actually expected.
So the ingredients that go into a flu vaccine are are different every year then? Right.
Actually, just the virus changes. It's like some mutation, actually, the variants. And then those variants actually just emerging more often in the case of the flu viruses.
Right. Dr. Kim, regardless of these doubts then, which groups do you believe need to be inoculated against the seasonal flu? And what can you tell us about the timing of this inoculation?
Well, first of all, the elderly people should get the flu shot, and also the people with some underlying just medical condition. And then for the very young children, for example, for flu shot is actually available for just young children above the just 6 months of age. So then it's now just compared to the COVID-19 vaccines. Now just based on some recent clinical trials. Now in the U.S. maybe more than just 5 years old, but now in Korea we are just more than 12 years old. So then there's some substantial gap that in terms of the eligibility for the vaccination for just flu and then COVID-19. So at least for these young children who are not eligible for the COVID-19 vaccine, they actually had better get the flu shot. And then for the some ideal time for get the vaccinated for the flu, and then ideally it's September or just until the end of this October. But once it is just over this period, it is still just getting just vaccinated than not.
Right, I see. So hopefully we should be able to do this within the month of October at the latest then.
Hopefully. Yeah.
Right. Professor Kwak, now, authorities have said that both the seasonal flu and COVID-19 vaccine can be taken at the same time. This is something that my colleague Soa and I addressed earlier on. What are your thoughts on this?
Well, obviously, I completely agree with the stance. Well, the protocol sort of changed about last month or so. It used to be that because we did not know much about the interference or the co-inhabitants of these two different vaccines at the same time, it used to be recommended that they should be at least 2 weeks put apart for different types of vaccines, either before or after COVID-19. Now we have the world has come to conclusion that having vaccinated already millions and millions of people, that they saw no certain side effects to increase because they were co-injected. There was also a recent study that came out of the UK where they compared people having received both the shots at the same time or against the people who received one plus a placebo, and they saw no big difference in side effects or even the severity of the side effects from those two groups, showing that people who receive both the shots, flu shots and COVID-19 shots together should not have any more side effects than the people who has just one of the vaccines.
Right. Now, Dr. Kim, starting like mid this month, there'll be a host of inoculations taking place for booster shots for healthcare workers and the elderly. We have young teenagers starting their inoculations as well, pregnant women. What measures do you suggest to ensure or discourage or prevent, that is, mishaps?
Well, we have some couple of just mistakes that happened in the past, even for just the same just COVID-19 vaccine, also just different kind of COVID-19 vaccines. So I think this Korean government was probably just considering some new implementation to avoid such kind of mistakes. But personally, I think we have to somehow just separate the groups of this vaccination in time and also space. For time-wise, maybe we can just set up a different just vaccination schedule, so not just vaccine all at the same time. And also in terms of space, we can just designate some one room for like some COVID-19 vaccines and the other room for like flu vaccines. But this is my just a personal thought. Yeah.
Right. And staying with flu vaccines, Dr. Kwak, what efforts do you propose to perhaps boost public participation in our seasonal flu vaccination campaign?
Well, we have probably discussed the same matter with COVID-19 vaccines before. Obviously, we can offer incentives to those people who receive both the shots, such as maybe allowing to gather a little more closely or larger in numbers. But considering what's going on right now, we have become much more complacent, compare ourselves to what happened last year. I guess we need to educate ourselves what has changed thus far, that we have gotten much more used to living with COVID-19 as it is right now, but we have also become much more physically closer than before because we're slightly less scared of the disease of COVID-19 than the last year. So we need to educate people that as a society, we have become physically much closer, and that would expose us to higher possibilities of getting either the co-infection or influenza or COVID-19. So we need a method to educate ourselves and remind them that they all should get influenza shots when they're offered, but also the fact that influenza shots are available for free to certain groups of people. Maybe we could inform them those facts as well.
Right. And before we end the program, Dr. Kim, I'd just like to ask you about Pfizer's efforts to use the mRNA platform to develop a flu vaccine. What can you tell us about this?
Well, the vaccines that we are using for just the flu is mostly just inactivated vaccine, which is just a killed vaccine, and the other one is live attenuated vaccine. And then, well, but mostly I think it's a killed vaccine is a major one, and then in this vaccine is mostly just induce B cells, so which is actually eliciting just a neutralizing antibody. But the efficacy is, if it is good, the prediction is good, the 40 to 60%. But for the mRNA vaccine, that as we actually experience in the COVID-19, this actually elicits both B cell and the T cell response. So it's the antibody response and the cellular immune response. That's probably why we are achieving very high just protection efficacy, like more than 90%. And then one of the advantages for mRNA vaccine is that you can actually develop very fast compared to the conventional just flu vaccine. Once we have the genome, just a viral just genome information, we can actually generate it very fast. So we actually just remember that the Pfizer also announced that for the vaccines, the potential vaccines for variants, they said they can actually develop within 3 months.
Right.
Because the information is just the only thing they need. So I think maybe just this fast development is one of the just advantage for this mRNA vaccine, and then very fast adapt themselves to the newly emerging just the type of just, the viruses as well.
All right, Dr. Kim, as always, thank you very much for your insights. Professor Kwok, thank you for being with us today.
Thank you.